good evening. Hello. Welcome to my medical education stream for the month. Hello, Abdul, Rosel, Mushroom. Hello. Archetype, hello. Okay. Wait, let me fix some stuff here. Okay. Pichu, hello. Hello, Hentai, hello. Okay. Yeah, okay. Actually, I am not that prepared for this stream. I mean, this is very short notice, so I wasn't really able to prepare slides for this. Because this is something kind of an emergency. Hello, Grub. Hello. Kind of an emergency, okay. So today's stream is a medical education stream. We're gonna talk about a case of a patient of mine who really needs help. Okay? It's a simple case, but it's not so simple for the patient. Okay? Also, aside from that, we're gonna talk about health insurance in the country, in the Philippines. Okay, because yeah, I'll let you guys. I'll tell you why. All right. So this stream, this medical education stream, is basically a precursor or a prequel or whatever, introduction to my upcoming Donathon. Okay. I have a Donathon which I'll start on Wednesday for that patient. And I'll tell you why. Alright? So, I have my tablet with me. Where's my mouse? Where is my mouse? Oh, there we go. Let's see. We need a nice brush here. Let's use a crayon. Let's use green. Why is it so big? Size. Oh. Alright, there we go. Hello, Noe. Okay, so first I'm gonna start off by mentioning the case of the patient, okay? So this is a young adult, an adult male, so adult. Oh wait, I don't have slides for this, so I'm gonna have to end up writing everything. Let's use okay, here we go. Case. Case. Okay. Alright, so the case, we have this is green. We have an adult male, okay? Adult male. I'll tell you about the case, alright? Adult male. Who does not have insurance. Okay, this is why. So this is why we're gonna talk about insurance later. He does not have health insurance, no HMO, not even PhilHealth. Okay, for those who are not from the Philippines, PhilHealth is the universal health insurance for the country, and then there's also like HMOs, which are like health maintenance, like usually company related HMOs, which also insurances that help out. Alright, so this guy, chief complaint, alright, chief complaint. Chief complaint, CC, abdominal pain. Abdominal pain. Oh. Okay. So this patient has been complaining of abdominal pain for quite a while. Alright, probably years. On and off abdominal pain. So, let's write it down. History. let's make it. So he's been having years of abdominal pain, on and off abdominal pain. Abdominal pain. Okay. More on, like, he would say the middle of his abdomen. So he would take, he has on and off abdominal pain, and he would take, would relieve pain with, would take omeprazole, or a PPI, would take PPI, proton pump inhibitor, or omeprazole, would take omeprazole. Omeprazole for pain relief, okay? He would take omeprazole and it helps a little. So, temporary pain relief. Temporary, it should give him temporary relief, okay? Temporary relief. Okay. If he would, he had a checkup. So he would check up with, he would check up with a doctor, with doctor, and he got diagnosed with GERD, okay? Diagnosed with GERD. So they would tell him to continue the omeprazole, okay? So they would tell him to continue the omeprazole. GERD is gastroesophageal reflux disease, so yeah. Okay. So after that, he also checked up with. He also was advised ultrasound, but didn't have it done, okay? Advised to have an ultrasound done. But didn't have it done, okay? Because, funds. Advised to have an ultrasound, did not do it. Because no money. No money. Okay, he lacks funds, alright? Okay. So, he continued to have on and off pain. So, on and off abdominal pain continued. Abdominal pain persisted, okay? Oh my god, I spelled persisted. Persisted. Alright. He still had on and off abdominal pain, and then finally it got, like a week ago or so. Until, 1 week ago. So, 1 week ago. Wait, 1 week prior. 1 week prior to consult. Okay. 1 week prior, his pain got really severe, okay? Had severe abdominal pain. Okay? He had severe abdominal pain again, and then, because of how bad it was, he checked up again, okay? Checkup done. He checked up again, and this time, they did an ultrasound. So, ultrasound was done. And lo and behold, in the ultrasound, he has gallstones, alright? How do I make this? Let's make the canvas a little larger. larger. There we go. There we go, okay? So... Alright, so what was seen in the ultrasound? So he had an ultrasound done. And they saw gallstones, okay? Gallstones seen. Oh. Where's the brush? Gallstones were seen. Gallstones on ultrasound. I will describe the gallstones in a bit. Oh, I spelled gallstones wrong. Gallstones on ultrasound. Actually, I think it was one gallstone. I'll look at it again. Advice, and so advised surgery. Okay. Alright, so what exactly? So here I will let you guys know the ultrasound results. So the actual ultrasound result. Let me write it. So the ultrasound. I'm just gonna put the pertinent ones, okay? Results. Oops. Okay, just the pertinent. I'm just gonna say the pertinent data in the ultrasound, okay? Oops. There we go. Wait, where is that? Hi, Rian! Okay, where is that? I have the ultrasound somewhere here. Hold on, guys. Let me whip out the ultrasound. I'm just gonna write it down. We're just gonna focus on the pertinent result of the ultrasound, okay? So... Alright, here we go. So the ultrasound... Where is it? We have a... Alright, gallbladder... Gallbladder measures 5.2 by 1.8 cm. Just so you know how big his gallbladder is. And with thickened walls. Okay. Walls of the gallbladder are thickened. So I'll just shortcut gallbladder to GB, okay? GB walls are thickened. And it says here it's around 0.67 cm. Alright, and then negative Murphy sign. I'll let you guys I will tell you what a Murphy sign is. Negative Murphy's sign. Okay, and then we have a there is a 1.14 cm stone. Oh, it's just one stone. Okay, he has gallstone, not gallstones. 1.14 cm stone. And the common bile duct is not dilated. Common bile duct, so CBD is common bile duct. CBD, not dilated. And it measures to 0.23 cm. Yeah, that's all the pertinent data, okay? That's the pertinent data. Alright. The handwriting is literally sus- What the hell? Stop talking about my handwriting, okay? That's not important. Alright, so that's his ultrasound. Let's see. Oh, past medical history and family history. So, past medical history? Okay. His past medical history, he doesn't have any comorbids. Past medical history is negative. Family history, I think like hypertension, if I remember correctly. Hypertension, if I remember correctly, yeah. Personal social history, He's a non-smoker. It's unremarkable. Non-smoker, non-alcoholic beverage drinker. Okay. You have good handwriting. Really? A lot of people say my handwriting is bad, but maybe it's because I'm not writing fast. If I write really fast, it's bad. But you know, there are worse people there are people with worse handwriting than me. All right. So this is his case. So he was advised surgery. Now let's break that. Let's look at the ultrasound results, okay? Let's look at the ultrasound result. The gallbladder size is not really that, you know, we don't really pay much attention to the gallbladder size. So, nothing much about that, but this one right here, let's see. Gallbladder walls are thickened, okay? Thickened to, 0.67 cm. That's half a cm, okay? That's half a centimeter. That's pretty thick. That's a pretty thick gallbladder, and yeah. This just means, what does this mean? It means that he's had that stone for quite a while. So the whole time he said that he has been having on and off abdominal pain for years. That means when he was advised to have an ultrasound done, if he had it done, he would have noticed the stone a lot earlier on, but he didn't do it because he had no money. And he tolerated the pain for quite a while until 1 week ago. The pain was a lot more severe now, so yeah, his gallbladder walls are irritated. It just means that the stone has been rolling around in his gallbladder for years. You know, when you have a stone inside the gallbladder, it just rolls around, scratching the walls, and eventually just causes inflammation. He's a stone keeper. He's a stone keeper. Bruh. Okay? So that's the reason. So that's one indication that, you know, we gotta do something. Murphy's sign is basically like, when you say Murphy's sign, it means when you palpate the abdomen on the right upper quadrant, on the right upper part of the abdomen, and if you tell the patient to breathe deeply, it will hurt. So in this case, it doesn't. So probably when he had this ultrasound done, the pain was less. So that's probably why he had a negative Murphy sign. But I'm pretty sure that if this was done, like, earlier on, he would have a positive Murphy sign. Okay. His stone is about 1 centimeter or 1.14 centimeter. That's a bit large. That is a bit large. So it's just rolling around. It's been rolling around there for quite a while. And his common bile duct is not dilated, which is a good thing. Because if the common bile duct is dilated, then we're gonna have a problem. I will show you the anatomy of the gallbladder in a bit. Hold on, let me show you. Actually, I have a stream. I had a stream about gallbladder and the surgery. It was a collaboration with Sir Wheatbread, another VTuber. He was a bread VTuber who had his gallbladder removed recently, like sometime last year. Was it last year? I think it was last year, yeah. And he decided to show us or share his experience, and I was able to explain it. So if you guys want to know more about the gallbladder and the gallstones, you can check out that stream. I'll link it later. Okay, here we go. There we go. Oh my god, wait, someone's calling me. Wait, hold on, I gotta take this call. I'll be right back, hold on. Okay. Sorry about that, guys. I had to take that phone call. sorry. Judy calls. Yeah. I had to take that phone call. It was it's work related. About a patient. So anyway, back to this. Yeah. Here we go. Okay, so here's an image of the gallbladder, the anatomy of the gallbladder. So over here we have the liver. So this is your abdomen, so you can see your two nipples up here. This is the chest up here, and then abdomen is below. You have the liver, your gallbladder is underneath the liver. This is the stomach. And then this one is the small intestine. So stomach, first part of the small intestine, which is called the duodenum. And it goes around here. And this one over here between the small intestine and the stomach is the pancreas. Okay? And when we zoom in, we look at the gallbladder. So this is the gallbladder with stones. So we have here a gallbladder with multiple stones. We have one, and then they tell you where the stones can be located, where the stones can be found. So based on our patient's ultrasound, it's just within the lumen of the gallbladder, or just in the gallbladder. So we can probably say that he has a stone like, let's make a black stone. He has a 1.40, so he has only one stone, so it's probably just, probably has like one stone right there. There we go. He just has one stone floating around, rolling around there. He probably had pain because it was rolling around, or the stone probably lodged itself over here. The stone probably lodged itself over here to be stuck in between the neck and the cystic duct. Okay, because if it lodges itself over here, the gallbladder starts contracting, and that also causes a lot of pain. The bile inside the gallbladder cannot go out, so it's just stuck there. That's probably what happened. Okay. Now, if you have a stone that goes down to here, which is the common bile duct, this is the common bile duct over here. If you have a stone there, if you have a stone that gets stuck in there, your common bile duct will, as a result, it'll dilate proximally or here. And what happens is the bile is unable to flow into your intestine. And when that happens, you turn yellow or jaundice. Okay? That is jaundice. And when you have something like that, that is not exactly an emergency unless you have fever and you're starting to be septic. But it does need surgery, urgent surgery. Okay? As soon as you go to the hospital, you're gonna be admitted and you're gonna be scheduled for surgery. But it's not like an emergency like other super emergency. It's just something that you have to have done while you're in the hospital. Okay? So, in our patient's case, he just has a stone in the gallbladder that's been irritating his gallbladder for years now. And when you have a symptomatic gallstone, the advice is really to have surgery, because it can get worse if you leave that stone there. If you leave that stone there, there's a chance that it could be lodged into the neck and then, clog it up. And it can actually cause your gallbladder to necrose. It can cause infections. If the stone just forces itself through here and then gets, lodges itself here, you can turn yellow, get jaundice, and you'd need a bigger surgery for that. So that's why if you have evidence of gallstones and you are symptomatic, the advice is have it done, have the surgery done. Okay? Will the stone only be extracted? No, the whole gallbladder has to be removed because your gallbladder is diseased and you're a stone former. Is it not possible to get that thing dissolved while... Some people have this medication that helps in dissolving gallstones, but it's not advisable. I mean, some doctors would say, oh, you should try this, but, It doesn't always dissolve everything. The gold standard or the proper treatment for gallstones is to have the gallbladder removed. Okay? You can only prevent the symptoms, but it gets worse as the older you get or the longer the stone stays in there. Do you get jaundice if your gallbladder makes too much bile or if it's just blocked? If it's blocked, not the gallbladder being blocked, okay? It has to be the common bile duct that is blocked. If this is blocked, you won't have jaundice because the bile is produced by the liver. And you can see this tube over here. This is connecting to the liver, the hepatic duct. So you still have bile that flows. It just doesn't go to your gallbladder. Your gallbladder is just gonna, necrose or get worse, and you'd still need to have that removed. If the stone is here, then yeah, you would have blockage, and that would cause jaundice. So worth a shot in mild cases, but ideal. Yes. When you have gallstones, especially when it's symptomatic, when you are having on and off pain already, you gotta have that gallbladder removed. There are people who have gallstones but have no pain at all, and that's fine. Those are the ones who, they live their life, they have gallstones, but they don't feel anything, they just die with their gallstones. And that's okay. The thing is, if you know you have gallstones and you have been having pain for it, then it's advisable to have it removed. So this patient, if he had the gallstones and was not having pain at all, even if he had that gallstone for years and he doesn't have pain, then I wouldn't touch this, considering that this patient is already having a hard time with funds. So I would just leave it. I'm like, okay, you can just leave it, we can just observe it, and then if it gets worse, or if you start having pain, then that's when we'll think about surgery. But unfortunately for this patient, he has been having pain for years. And it's only just recently when he had the ultrasound done because of the severe pain, and yeah, there we go. We got a gallstone. Okay. Do gallstones decompose? Not really. No. Okay. In my case, the gallstone pain was very, very episodic. But when I had pain, the pain was massive to the point of not being able to breathe. Yeah, that's it. That's it. That's how it is. It's on and off. It's on and off, and then it just gets really bad. Okay? So, this is the case. Now, what are the problems? Okay, problems. Let's input the problems here. Problems. Let's use orange. Problems for the patient, okay. Okay, problems. This patient has... He cannot afford his surgery, okay? This patient cannot afford his surgery. Usually, okay, if you for a okay, wait, before that, the treatment for this, I forgot to write it down here. The plan for this patient, I forgot to write that down. The plan here for this patient, so plan. The plan for this patient is laparoscopic cholecystectomy, which is the gold standard for removing gallstones. Laparoscopic cholecystectomy. Okay. Lap chole. Yeah, let me look for some laparoscopic cholecystectomy. Let's get some photos. Here we go. This is a good one. I found a good photo. I hope this photo will fit. Alright, here we go. I don't know if you guys can... Oops. Alright, here we go. It's a little blurred, but there we go. Alright. Laparoscopic cholecystectomy. So we have two procedures here. On the left, we have laparoscopic surgery, and on the right is the traditional open surgery. So the gold standard for gallstones is laparoscopic because you just have tiny incisions here. Usually, this one right here is supposed to be at the belly button. You have one incision in the belly button for the camera, for the laparoscope, so I have no idea why this is up here. But usually it's over here, and then you have more chokers here for the instruments. And then you just like maneuver it a bit to remove the gallbladder, and you slip it out through the belly button. Okay, that's how it's done, and then you just close it. There are 4 incisions, and they are very small. Very, very small. And the recovery is a lot faster because the incisions are very tiny. Is this a major operation? Yes, it is. Now, the other option is open, but the difference is the cut is really big, and this is actually pretty painful after the surgery because it's a big cut. And yeah, it is painful after the surgery, so yeah. The gold standard would be this. Although we always explain to the patient that the chances of this, it's not a 100% surgery, meaning it'll 100% be done laparoscopically. There's always a chance of conversion, although the chance is pretty small. I'd say around 5 to 10% of laparoscopic surgeries would convert to open. So you just gotta we just explain that to the patient that there's a tiny chance that we might open. Okay. Alright. So, back to here, back to the problems for the patient. Okay. The problems of the patient, so as I mentioned, is... problems of the patient, low on funds, okay? Low on funds. He cannot... low on funds. So this is a simple surgery. It's simple, but it's a major surgery. Okay. Low on funds. It's not a surgery that is an emergency or like super big like cancer surgery, but it's still considered a major surgery, and he is one of the patients that needs to have this done because the pain won't go away. It will continue on, and it can get worse, which is why I have advised him that you need surgery. But then he expressed that how much, you know, he's having a hard time because of funds. Okay? I mean, the fact that it took him years to get an ultrasound done says something. That he really can't afford it. So he's low on funds. He also has no insurance. That includes PhilHealth, which is the universal insurance in the country. Okay? So that includes no HMO, no PhilHealth. Alright? Doesn't have PhilHealth. Okay. Now, no, he does not have PhilHealth. Maybe we can say majority of the Filipinos have PhilHealth, but that's just majority, and there are still people who don't have PhilHealth. I've had a few patients who don't have PhilHealth, and it's really hard. Okay? It is a must-have, yes. That's why I told them you better get your PhilHealth done, but, you better get PhilHealth. But yeah, you know, the problem is, it might take a while before he gets his PhilHealth, and his gallstones can get worse. Okay. Can he not just go to public hospitals where they can fix him up for free? Yes, this is one thing I advise. Like, you go to a public hospital, but he has been calling And you know how some public hospitals are. You call them and they don't answer. I mean, even us doctors, when we have to refer a patient to another hospital and do coordinations, they take forever to answer their phone. They take forever. And you know, even for scheduling, if you do a walk-in, it's really hard. It takes a really long time before you can be scheduled. Yeah, it's really hard. Yeah, it's hard. So and especially when he needs to have it done. DSWD and PAGCOR can help. Yes, actually. The thing is, they have to have, I think, if I remember correctly, they interview you for that stuff. But there's some, yeah, he needs a 9-month contribution to be able to use PA. Yes, that. Unfortunately, see, he would have to wait 9 months. He would have to wait 9 months. And when I saw his ultrasound, I'm like, I don't know. I have a feeling that you're gonna have another attack. If you've been having this for years, on and off, it's gonna be... He might come back to me worse. Okay, I don't want I do not want this patient coming back to me with jaundice, okay? Because that is one thing I do not want to see. Jaundice patients, patients with gallstones and they have jaundice, not pretty. Sometimes it's complicated. It gets complicated. Okay, especially when they start having fever, they start having hypotension, fast heart rate, and then they get delirious. It's really bad. Okay. So, I did a little bit of research because I wasn't so sure about how much a laparoscopic cholecystectomy would cost if you don't have any insurance at all. Okay. I asked, and in another hospital, it's around 90,000 and sometimes 100. Okay? 90 to 100,000 pesos to have this done, and that's just procedure alone, okay? That is just procedure alone. That does not even include other things that might be added. Because you never know that something happens during the surgery and he would have to be admitted a little longer than usual. Yeah. I was actually surprised. I did not know it cost that much, to be honest. Because I never really asked. Usually, if they have PhilHealth, is cool. It's covered. They don't really, you know, they don't really pay that much. Hey, this is without insurance, okay? That includes no PhilHealth, no HMO, no nothing. That's how much it is. Now if you have PhilHealth, let's say you have PhilHealth, okay? If you have PhilHealth, the cost of the procedure is a lot less. It's actually like 40,000 pesos. 40,000 from 100,000 pesos to 40,000 pesos. Okay, let me write this down. No insurance. So 100K. With PhilHealth, around 40K. Okay. You're lucky. If you guys have an HMO, you guys are lucky. Okay, HMO helps a lot. Yeah, the laki ng bawas. As in, it's a big, anyway, I will talk about PhilHealth. So this is actually why. This is why I wanted to help this patient, because he needs the gallbladder surgery. I do not want this patient to come back to me being jaundiced, okay? Which is why I advised surgery, and he expressed to me that he has no insurance and he needs to have this done. And knowing our government and stuff, it's going to take forever before he gets everything done. So, bleh. Cholecystectomy, yes. Laparoscopic cholecystectomy. Okay, let's see. So we go to our next. I have some slides here. But it's really very brief. See, I kind of crammed this. I crammed this because I didn't have time to really prepare, because it was sudden and it was pretty much an emergency. Wait, hold on, let me prepare my. Where is it? Hold on, let me see. There's a slide. Okay. Oh, Hannah. Health insurance in the Philippines! Okay, wait, let me see. Let me see the questions here. Private HMO. Yeah, private. Usually HMOs are given to you if you work for a company. They usually have HMO to cover you, and that's actually a good thing. Private, you can also go for private in HMO, but you need to pay. I think you need to pay. What's a suggested diet plan? Oh, diet plan. Yes. Okay. So while he's waiting for this, I told the patient, okay, while we're going to prepare you for surgery, if you want to make sure you don't feel the pain as much, I advised him to have to have a low-fat diet, okay? Because fatty foods trigger the gallbladder to contract and to push out the bile, because bile helps in digestion of fatty stuff. So I told him low-fat diet, and I started him on some oral antibiotics. And then pain relievers. So that should buy us some time. Is this case conference? Yes, it is a case conference. All right. The VOD will be up after the stream, right? Yes. I actually have a more in-depth gallbladder stream, medical education stream up. It was a collaboration with Sir Wheatbread. I have it somewhere there. You can just check it out. I even show pictures of his gallbladder if you want to see how his gallbladder looks like. Alright. Ano ba mas magandang HMO, like IntelliCare or health insurance? It depends, actually. It depends on what you like. I don't know. Me, I prefer HMO. Are antibiotics just for prophylaxis? Yes. Ouch. Yes. I hit my foot. Sorry. Chris Underground, thank you for the sub. Mahilig ba sa beer yung patient? Nope, he does not drink alcoholic drinks. MaxiCare. MaxiCare is good. IntelliCare is good. I've worked with some doctors who are under IntelliCare and MaxiCare. So, okay. Oh, this is interesting. You have a new subscriber. Thank you. Yeah, this is a stream. Just a while ago, I was talking about a case of a patient I have who needs help with his surgery. This is basically a precursor to my Donathon, which I'll hold on Twitch. It's for my patient who needs help with funds. Alright, anyway, let's go through this briefly. This is a very ill-prepared slide, okay? I just crammed this, like, this morning, but I'm not able to really, I'm not really able to put in everything. So, I did say yesterday that I was gonna do some reading, but it was really hard for me to do this because I'm also busy at work. So screw up PowerPoint. Yeah, it's just black and white, really. Okay, oh, what? Why is the slide not moving? The slide is not moving on my on the OBS. What the hell? Wait, hold on. Okay, let me fix this. Hindi gumagana, anak ka. Alright, hold on. Let me, Why is it not working? Oh yeah, the slide is not moving. Hold on. Oops. Oops. Why is the slide... There we go. It's not moving. Why? The slide is not moving! What the... Fuck this. Fuck OBS. Tag-ina, ba't di gumagalaw? Wait lang. Okay, we're gonna have to do this the other way. Oopsies. Okay. Hold on, guys. Oh, I think I know why. I think this is why. Hold on. I think I got it. No, it's not moving. Hindi pa rin gumagalaw po. Okay, there we go. I got it. Okay. I got it. Ha! I got it. Alright. Ha! What is PhilHealth? Okay, guys, this is like me presenting a PowerPoint to class. What is PhilHealth? It is the universal health coverage of the country of Philippines. It is tax exempt. It is government owned, handled by DOH, and they give national health insurance for all. Yeah. I got this all from Wikipedia. Wikipedia gaming, let's go. Oh god. Kasali ba to sa exam? Yes, the slide is going to be in your exam, okay? You gotta memorize every word, every letter. Okay? Wikipedia lang to. Source Wikipedia. Alright. So, benefits. Why do you need PhilHealth? Okay. They cover the following, okay? PhilHealth covers a lot of everything. So, inpatient care. So, if you're admitted, or like, let's say in the ER or in a hospital for admission, they cover pretty much almost everything. So that includes diagnostics, medications that may be given, imaging, blood works, imaging, CT scans and all that, ultrasound, blah blah blah. They also cover surgeries. Surgeries done. Okay? Surgeries done, including deliveries. Not deliveries as in like babies being delivered, okay? Not food deliveries. They cover deliveries of OB-GYN patients. Alright, hindi yung delivery ng Grab tsaka Food Panda, okay? And they also handle outpatient treatments like dialysis, TB, tuberculosis. Actually, TB is supposed to be free, especially with TB dots, and all that. Okay, so Shopee, Uber PhilHealth. Okay, so no. Gagi. And yeah, you guys gonna order food from PhilHealth. Anyway. So yeah, this is why if you don't have PhilHealth yet, you better get yourself PhilHealth. Especially for those who are freelancers. You know, if you are not working under a company or if you're a freelancer and you cannot afford to have yourself a private HMO, you better get PhilHealth because it, you know, even if they have some questionable stuff going on there, because, you know, government, blah, 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 it still takes a chunk out of your medical bills, okay? It'll still take a chunk out of your medical bills. Of course, not everybody, even if they take a chunk out of your medical bills, there's still a lot of patients who still cannot afford their treatment, even if they have insurance. I mean, last year I did have a patient who I had a patient who needed help because he was gonna undergo a really, really big surgery. If I remember correctly, last year we did a donathon for him. He had a thyroidectomy done. So we had his thyroid was very big. It was so big that it was reaching into his chest, so we had to remove the thyroid. And we also had to open up his sternum or his chest just to take out the portion of his thyroid that's like right beside his heart. It was right beside his heart. Okay? So that patient has PhilHealth. And I think he was also... Wait. Was he a... I don't remember if he was a senior citizen because, you know, that also takes a lot. You know, it also gives you a discount. If you're a senior citizen, you get discount. Yeah. Yeah, mediastinal thyroid. He had that. So, he needed... he could not afford the procedure. So we had to help him. That's why I had a donathon. It's the referral to the TCVS or the chest surgeon or the thoracic surgeon that made it a lot more expensive because they are specialized. It's a subspecialty. So yeah. Free na PhilHealth. Yeah, I don't remember if he was a senior, but he had PhilHealth, but he still could not afford because, you know, there are patients that even if they have the insurance, they still cannot afford their treatment. Even more so, this one patient we are talking about right now does not have insurance, which makes it a lot harder. Cardiologist kasama. Cardiologist is more on medical. So, yes, but we did refer him to a cardiologist because, you know, it's right next to the heart. So he was for clearance. Alright, anyway. Controversies! Okay, ito. I'm pretty sure you guys know. I don't want to get into details about this one. But I think a lot of it came out during the pandemic. I did not put the details on here. Okay? Let's see. PhilHealth. Ito, isa-search ko na lang ha. PhilHealth fraud. PhilHealth fraud. Ay, nako. Okay. Oh my god, look at all these articles coming out here. Holy shit. Okay, hold on. Look at all that. You just type in PhilHealth fraud and this comes out. 15 billion PhilHealth fraud challenge trends on Facebook. PhilHealth mafia stole 15 billion pesos. 15 billion pesos. 15 billion pesos! PhilHealth pays for ghost kidney treatments. Holy shit, man. Oh my god, PhilHealth scam. Oh my god. Yeah. I don't want to get into the nitty-gritty of this, but PhilHealth sucks. It does suck, to be fair. I mean, it's an evil, but it's an evil that people still need. So even if even doctors themselves are pissed off with PhilHealth, medical professionals are pissed off with PhilHealth. But you still need it. Even if you're angry, you still need it because it still takes a lot out of your medical bill. Okay. Anyway, PhilHealth fraud. 15 billion pocketed by senior officials. Oh my god, the laptop! Oh my god, yeah, the laptop! Holy shit, I remember that. I remember that. Anyway, back to the... I don't want to talk too much about that because baka I don't wanna talk too much about that. Baka hanapin pa ako ng PhilHealth at hanapin na lang kung sino ako. They'll be like, who is this anime girl doctor talking about us and spreading the word about our fraud? Anyway, that's why I just don't want to get into detail. But you guys know that. So anyway, during the pandemic, I'll say this part as on our side, okay? During the pandemic, if I remember correctly, this thing came out, and if I remember correctly, some of the PhilHealth officials were blaming it also on doctors, like it's because the doctors they're actually doing the fraud, they're lying to us about all these procedures, blah 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 blah. And I think, if I remember correctly, the Association of Doctors replied to them, and they really answered back. So the thing is, on the medical professional side, they are also pissed off with PhilHealth, especially during the pandemic, because the doctors were not being compensated enough. So we were not being compensated enough. And of course, you see, yeah, they pocketed the money, of course. They pocketed the money, 15 billion. Which is why they were pissed off. They were pissed off that PhilHealth was blaming doctors for it, and yet they pocketed 15 billion. Okay. We get exploited. Yep. Oh my god, don't get me started with the Heya. Don't get me started with the Heya, man. The Heya, okay, for those who don't know, Heya is health emergency allowance. So this is supposed to be given to healthcare professionals, especially during the pandemic and after. But yeah, there are professionals that have not received their Heya. Okay, have not received. There are a lot who have not received their Heya. There are some who did receive it, but it took them years before they received it. It took years, okay? It took some months and some years before they even got it. The others didn't even get theirs yet. Okay, that's the thing. It took us a while. It took us years. Then for me it took years. Oh god. But anyway. Yeah. Anyway, back to the okay. You remember this, yeah? Okay, so, other things about PhilHealth. There are a lot of forms that medical health professionals have to sign. That is PhilHealth related. There's really, especially for inpatients, there are a lot of forms. So, what do doctors need to sign and fill up for the PhilHealth? Usually we have to write the diagnosis, the procedure done, and there is a code that we put. There is a code that we put, which is called the RVS or the RUV code. So, and that code is what tells us roughly how much the patient will have to pay, or how much the procedure will cost. More like how much the procedure would cost, or how much the deduction would be. So, yeah. And these forms also, these are the forms that the nurses love to bug doctors about. You know, if you're a nurse, is anyone here a nurse? Because I'm pretty sure you guys know what freaking forms are. CF4, whatever. There's those forms. Okay, I don't want to. It's like paperwork. Takes forever, and it also annoys doctors a lot. Because we hate signing those things. Kaya pag na-discharge ang pasyente, ang tagal bago makalabas ng hospital, matagal process of yeah, it's the PhilHealth plus, oh yes, interesting. Okay, Roxel, Sometimes the reason why it takes a while is if your doctor's really, really busy and he hasn't signed anything, it takes a while before you get discharged. So this is why we have interns. Oh my god, insider knowledge. Okay guys, this is insider knowledge. If the intern's taking forever, it's their fault. We hate signing these things. It was a lot simpler before, actually. It's a lot simpler before the PhilHealth forms and shit. But recently, like the last few years, the last few years they made it a lot worse. The PhilHealth, like I think, yeah, they require you to put a day-to-day course in the wards. Okay, and that's annoying. It's imagine if you have a patient that was admitted in the hospital for like 2 months because he's in the ICU. And you know, if you're in the ICU, things happen to you in the ICU. A lot of things happen in the ICU. Imagine being admitted in the ICU for like 2 to 3 months, and then PhilHealth would require you to put day-to-day updates on their freaking form. So, I know, as far as I know, in our hospital, it's computerized. I don't know in other hospitals, but it's just, this is why we have interns. This is why there are interns. Okay. It is pretty tedious. It is very tedious. PhilHealth made it a lot more tedious. Yes, it takes forever. It takes forever. Day 1, patient unconscious. Yeah, day 1, patient unconscious. And then you do a lot of blood works taken, started the patient on peptides, blah 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 blah. Day 2, patient underwent whatever, ultrasound done. Day 3, patient arrested. Day 4, patient awake, alert, blah 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 blah. Cause of unconscious ang taas na. Yeah, Russell, I apologize on behalf of all doctors, from intern to resident to consultant, to take forever to do the paperwork for your PhilHealth. We just hate doing that shit. We don't like it. But we gotta force ourselves to do it, because or else you guys can't go home. But yes, it does take forever to do. Especially if, you know, especially if they've been admitted for really long. So. I'm sorry. Okay, what is next? My next slide. Oh, here. Health maintenance organizations. This one I wasn't really able to complete, but HMO, it's, so, HMO is an insurance, made by doctors, so mostly are healthcare providers. It's just that they agreed to lower their rates for any member of that HMO. It is prepaid. If I remember correctly, there's like levels or tiers, like gold member or some shit, or platinum member, regular member for this, and for each, I think there's a different coverage. And they do an annual coverage, and it's, you can use it up. Battle pass. You can put it that way. It's a battle pass for patient battle pass. That is one way to put it. It is a patient battle pass for your health, for their health. HMO is the patient battle pass for their health. That is a very good comparison. Pay to win, yes. Alright, in order to use this health battle pass, let's say you have, you know, gallstone, and you gotta be operated on. You can't just have this, you can't just get any doctor to do it for you. That doctor has to be covered by the HMO, so he has to be a member or covered by whatever HMO. So like, for example, this one doctor's in telecare, and then, but then you want your HMO is MaxiCare. They won't cover him. Something like that. Okay. So that's the thing, and I think this is just my last slide, because I wasn't really able to. Yeah, see, it is. I wasn't able to really finish it. So if you work for a company, usually they have an HMO. Like some companies use Medicare, Medicard. There's MaxiCare. There's IntelliCare. There's Insular Life. There's a lot. There's a lot of different HMOs. So yeah. Some doctors are HMO doctors. Yes. Especially those who work in private hospitals. They usually are covered by HMO. So there's a coordinator that decks the doctors. For example, in some hospitals, if a patient comes to the ER and they say, "Oh, I have an HMO, I am MaxiCare, for example, or I am IntelliCare," and then there is a coordinator that they'll call him, and then they say, "Oh, what is the case? Oh, it's a gallstone. Okay, we'll deck this surgeon." under IntelliCare. Oh yeah, that. Yeah, they have a coordinator. There's like a lot. So if you are work under company, most likely you will have an HMO. So if you have HMO actually has a, what do you call this? It has a large coverage. Like I know, if I remember, Sir Wheatbread has an HMO, and he had his HMO cover his fees for his surgery. So yeah, it really covers a huge chunk. Okay. Yeah, they verify it. I know that Sir Wheatbread used an HMO, and they covered his surgery. I don't know if they covered everything, but they covered a huge chunk of it. And if ever they hit the limit, then he just paid for the rest, something like that. I mean, when I had my surgery, I had surgery on my wrist. If I remember telling you guys like 2 years ago that I had Decurvain tenosynovitis on my right wrist, and I could not do surgery, and I could not write for 2 months because of the pain, and I underwent surgery for that. I had an HMO, so I used it, and I didn't have to pay a cent. I did not pay a cent, or well, I did not pay a centavo or a peso for my surgery. They also covered my rehab, my physical therapy, my rehab for my wrist. Yeah, it was 2 years ago. You guys realizing that it was 2 years ago? Yes, it was 2 years ago. No, it wasn't last year. It was 2 years ago, yo. It felt like last year for Now I'm confused. Was it last year or was it? It was 2 years ago. Wasn't it 2 years ago? Or ako ba yung mali? No, I think it was 2 years ago. Because I remember doing so much surgeries last year. No, it was 2 years ago. You guys are tripping, yo. Because last year was when I couldn't stream remember, last year I could not stream properly because I got so busy, right? There was like 4 months of when I couldn't stream properly because I had so much surgeries to do. So that it couldn't be that because I was doing surgeries. 2 a.m. stream. Yeah, last year I was doing 3 a.m. streams or 2 a.m. streams. So it was not my hand surgery was not last year. It was 2 years ago. Okay. It's you guys. You guys are tripping. Okay. So yeah. That's all of it. That's the end of it. It's 10:25, so yeah. So yeah, the purpose of this stream is to just tell you the case of the patient, alright, and why we are doing the donathon, because yeah, he has no funds. He needs the surgery because he's been having that pain for quite a while, and I just don't want him to get worse. Because there is that potential for it to get worse, especially since he's been having that pain for years, and he does not have insurance. Okay, so I will be holding a donathon. I will start it on Wednesday. Wednesday's a holiday, right? So I'm going to start at 2 p.m. My plan is to start the donathon at 2 p.m. Wednesday we'll do a 8 to 10 hour stream on Wednesday, and then I will continue the donathon for about 2 weeks. Okay, so Wednesday will be the long stream, and then the streams after will just be like the usual streams I do, like 3 hours a day. Because I can't exactly do uncapped donathons because I am a busy woman. I have work. Bukas din holiday. Yeah, tomorrow's a holiday, but I am on call. I am on duty, so I can't do it. I can't start tomorrow. I am going to fix the dono goals in a bit. I will post the details tomorrow. But our donation goal is, as you can see up there, 100,000 pesos is roughly $1,800. So I will put the donation the goal is 1.8, but I'll have a stretch goal up to 2,000. So if we can reach that, that would be really good. We can actually help the patient. So the goal is the 100K is 1.8. The extra $200 to complete the 2,000 is just for any extra or miscellaneous fees that might be needed for, you know, while he's admitted. Because you never know that he might convert to open surgery or something might happen. You just never know. Okay? So that's why that's what this stream was for, to prepare for the donathon. Okay? Yung holiday ko haba pero Alright, so yeah, let's move on, guys. Thank you for coming to my stream, and I hope you guys can support I hope you guys can help this patient. Okay? I will post more details maybe tomorrow for this patient. Okay, the donathon, the dono goals, and everything. Lots of PhilHealth. Lots of PhilHealth. Oh my god, PhilHealth better not look for me. Otsu insurance. Hopefully we can help him out, okay? Because he really needs it. I don't want him to get worse than he already is. It's a simple surgery. It's not a cancer surgery or a really complicated surgery like the last one. But this is just special because he has the insurance. And he would have to serve that 9 months to get PhilHealth, but that's way too long for me. But I guess while we're doing this, he can serve that 9 months, but have his gallbladder removed already. No raid, I have no one to raid. I'm reading YouTube. Otsu PH. Alright, guys. Maswerte kayo, guys. There's no quiz today. Next time I quiz. Oh, that reminds me, guys. The next medical education stream was suggested yesterday. We're gonna talk about the next time I have a medical education stream. I might hold it sometime this month also because I feel like I should. We'll talk about urinary tract stones, okay? Because a certain corpo VTuber had stones, and it's a very good discussion. I realized that I don't have a VOD about it, so you can rate on YouTube, yeah, but I don't know how to do it, and I think you have to be mutuals. Yes, we're gonna... Yes. Okay. Alright! Atsupan, everyone! Thank you for coming to my stream. I'll see you guys on Wednesday on Twitch. Okay? On Twitch. For the Donathon. Alright. Atsu. Bye-bye. Good night, everybody. Bye-bye.